हेलो दोस्तों, वेलकम बैक टू नर्स अड्डा। अगर आप नोसेट 2026 की तैयारी कर रहे हैं तो ये वीडियो आपके लिए है। आज हम डिस्कस करेंगे एग्ज़ाम ओरिएंटेड सैम्पल पेपर विथ आंसर्स एंड रैशनलिज़। अगर वीडियो पसंद आए तो लाइक, शेयर और चैनल को सब्सक्राइब ज़रूर करें। आज का सेट होने वाला है 9 और अगर आपने हमारा प्रीवियस मॉक टेस्ट नहीं देखा है तो जाके ज़रूर देखिए। आज भी हमारा टोटल क्वेश्चंस होगा रियल पैटर्न के ऊपर, जैसे कि 100। ओके, इंस्ट्रक्शंस पढ़ लीजिएगा। और नर्सिंग के होने वाले हैं 80 क्वेश्चंस और अदर्स होने वाले हैं 20 क्वेश्चंस। चलिए शुरू करते हैं। क्वेश्चन नंबर 1, ए पेशेंट विथ COPD इज रिसीविंग ऑक्सीजन थेरेपी. Which oxygen delivery device provide the most accurate FiO2? Your correct answer is option C, Venturi mask. Next question. A 6-month-old infant is admitted with acute diarrhea and shows sunken eyes, poor skin turgor, and lethargy. According to IMNCI guidelines, the child is classified as having. Your correct answer is option C, severe dehydration. Next question. A 9-month-old infant is expected to achieve which developmental milestone? Your correct answer is option B, sits without support and pulls to stand. Next question. A patient suddenly develops chest pain, dyspnea, tachycardia, and hemoptysis after surgery. The nurse should suspect what? Your correct answer is option B, pulmonary embolism. Next question. A patient is receiving intravenous vancomycin. Which nursing action is most important to prevent red man syndrome? Your correct answer is option B, infuse the medication slowly over at least 60 minutes. Next question. A newborn develops jaundice within the first 24 hours of life. The nurse should recognize this as. Your correct answer is option C, pathological jaundice. Next question. Which of the following is the earliest clinical manifestation of increased intracranial pressure? Your correct answer is option C, altered level of consciousness. Next question. Which electrolyte is mainly responsible for neuromuscular excitability? Your correct answer is option C, calcium. Next one. A child with nephrotic syndrome is at the highest risk for which type of complication? Your correct answer is option B, severe infection due to loss of immunoglobulins. Next question. Which vitamin deficiency is responsible for megaloblastic anemia? Your correct answer is option B, vitamin B12. Next question. A patient with pulmonary edema is most likely to have which type of breath sound? Your correct answer is option C, crackles and crepitations. Next question. Which of the following is the earliest sign of hypoxia? Your correct answer is option C, restlessness. Next question. Which electrolyte plays the major role in maintaining normal cardiac rhythm? Your correct answer is option B, potassium. Which artery is most commonly used to assess the pulse in an adult? Your correct answer is option C, radial artery. Next question. Which cranial nerve is responsible for hearing? Your correct answer is option B, vestibulocochlear nerve or cranial nerve 8. Next question. Which valve is affected in mitral stenosis? Your correct answer is option C, mitral valve. Next question. A primigravida at 32 weeks of gestation present with painless vaginal bleeding. The nurse should suspect what? Your correct answer is option B, placenta previa. Next question. Which electrolyte imbalance commonly causes muscle cramps and tetany? Your correct answer is option B, hypocalcemia. Which vitamin is essential for normal blood clotting? Your correct answer is option D, vitamin K. Next question. Which of the following is the most common site for intramuscular injection in infant? Your correct answer is option D, vastus lateralis. This is the most repeating questions in every Norcet exam. Okay. Next question is, which contraceptive method provide protection against sexually transmitted infection? Your correct answer is option C, male condom. Next question, the first stage of labor ends with. Your correct answer is option B, complete cervical dilatation. Next question, which congenital heart disease is known as the blue baby syndrome? Your correct answer is option D, tetralogy of Fallot. Which psychiatric disorder is characterized by elevated mood, overactivity, and decreased need for sleep? Your correct answer is option B, mania. Next question. The process of destroying all microorganisms, including bacterial spore, is called. Your correct answer is option C, sterilization. Next question. Which sampling technique gives every member of the population an equal chance of selection? Your correct answer is option D, simple random sampling. Next question. Which management function involved the comparing actual performance with planned standard? Your correct answer is option D, controlling. Next one. Which inventory control technique classifies items based on their annual consumption value? Your correct answer is option B, ABC analysis. Next one, in weight analysis, Life-saving items are classified as. Your correct answer is option A, vital. वेद एनालिसिस का फुल फॉर्म है वाइटल, एसेंशियल एंड डिसायरेबल. नेक्स्ट क्वेश्चन. विच कंडीशन इज कैरेक्टराइज्ड बाय मून फेस, ट्रंकल ओबेसिटी एंड पर्पल स्ट्रे? योर करेक्ट आंसर इज ऑप्शन बी, कुशिंग सिंड्रोम. Next question. A postpartum mother develops excessive vaginal bleeding with a soft, boggy uterus. What is the most likely cause? Your correct answer is option B, uterine atony. Next one. Which congenital anomaly is confirmed by a positive ortolany test in a newborn? Your correct answer is option C, developmental dysplasia of the hip or DDH. Next question. Which therapeutic communication technique encourage a patient to express feelings in detail? Your correct answer is option C, broad opening statement. Next question. Which level of prevention includes early diagnosis and prompt treatment? Your correct answer is option C, secondary prevention. Next question. Which research design is considered the gold standard for evaluating the effectiveness of an intervention? Which research design is considered the gold standard for evaluating the effectiveness of an intervention? Your correct answer is option C, RCT or randomized controlled trial. Next question. The recommended angle for intradermal injection is. Your correct answer is option A, 15 degree. Next question. Which nursing action is most effective in preventing pressure ulcers in bedridden patients? Your correct answer is option B, reposition the patient every 2 hours. Next question. Which nursing action helps to prevent air embolism while removing a central venous catheter? Your correct answer is option B, ask the patient to perform Valsalva maneuver during removal. Which position is most appropriate for administering a cleansing enema? Your correct answer is option C, left lateral or Sims position. Next question. After confirming cardiac arrest in an adult, what is the nurse's first action? Your correct answer is option C, start high quality chest compressions. Next question. Which congenital heart disease is characterized by a continuous machinery murmur? Your correct answer is option C, PDA or patent ductus arteriosus. Next question. Which defense mechanism is characterized by attributing one's own unacceptable thought or feelings to another person? Your correct answer is Option B, projection. Next question, which epidemiological study is best suited to investigate the cause of a rare disease? Your correct answer is option C, case control study. What is the recommended chest compression depth during adult CPR? Your correct answer is option C, at least 5 cm but not more than 6 cm. Next question, which sterilization method is most suitable for heat sensitive instrument such as endoscope? Your correct answer is option C, ethylene oxide ETO gas sterilization. Next question, a patient with glaucoma should avoid which group of medications unless prescribed? Your correct answer is option C, iron supplement. Next question, which pulse site is preferred for assessing circulation during infant CPR? Your correct answer is option C, brachial artery. Next question, which assessment finding is most characteristic of left-sided heart failure? Your correct answer is option C, pulmonary crackles. Next one, which clinical finding is most characteristic of hypoglycemia? Your correct answer is option C, cold, clammy, sweating. Next one, rails or crackles are most commonly heard in which type of disease? Your correct answer is option C, pulmonary edema. Next one, which hormone is responsible for milk ejection or let down reflex during breastfeeding? Your correct answer is option C, oxytocin. Next one, a newborn weighing about 2.3 kg at birth is classified as. Your correct answer is option B, low birth weight. Next question, which defense mechanism involves returning to behavior typical of an earlier developmental stage? Your correct answer is option C, regression. Next one, which assessment finding is most suggestive of intestinal obstruction? Your correct answer is option A, hyperactive, high-pitched vowel sounds. Next question, which of the following is the most common complication of liver cirrhosis? Your correct answer is option A, ascites. Next one, according to Henry Fayol, which management function comes first? Your correct answer is option C, planning. Next one, Which infection is transmitted primarily through the airborne route? Your correct answer is option B, tuberculosis. Next one, which electrolyte is the major extracellular cation? Your correct answer is option C, sodium. Next question, a patient with hypocalcemia is most likely to develop. Your correct answer is option B, tetany. Next question, which condition is characterized by boat-like rigidity of the abdomen? Your correct answer is option B, peritonitis. Next one, a patient repeatedly washes his hand despite knowing they are clean. This is a feature of which type of disorder? Very easy question. The answer is OCD, obsessive compulsive disorder. Next one, which stage of fever is characterized by shivering and a sudden rise in body temperature? Your correct answer is option C, onset or chill stage. Which position is preferred for a patient during lumbar puncture? Your correct answer is option C, lateral recumbent with knees flexed. Next one, the Mantoux test is administered by which type of route? Your correct answer is option C, intradermal. The standard dose of tetanus toxoid TT vaccine for adult is? Your correct answer is option C, 0.5 ml. Which position is most appropriate for a patient with epistaxis or nosebleed? Your correct answer is option B, sitting and leaning forward. Next one, which procedure require informed written consent? Your correct answer is option C, blood transfusion. Next one, a patient hears voices that are not actually present. This symptom is known as? Your correct answer is option C, hallucination. Next one, which position is preferred after a lumbar puncture to reduce the risk of post-procedure headache? Your correct answer is option B, flat supine position. Next one, which color-coded biomedical waste bag is used for disposing of contaminated recyclable plastic waste such as IV tubing and catheters? Your correct answer is option B, red. Next one, a patient believes that hospital staff are trying to poison him despite evidence to the contrary. This is an example of? Your correct answer is option B, delusion. Next question, which position is preferred for a patient in shock to improve venous return if there is no head, neck, or spinal injury? Your correct answer is option B, Treadlenburg position. Next one, which nursing procedure requires surgical asepsis or sterile technique? Your correct answer is option C, urinary catheterization. Next one, during blood transfusion or BT, vital signs should always be rechecked after the first. Your correct answer is option B, 15 minutes. Which of the following is the earliest sign of blood transfusion reaction? Your correct answer is option B, fever with chills. Which procedure is performed to detect occult blood in stool? Your correct answer is option B, GUAC or fecal occult blood test. Next one, the normal capillary refill time in adult is. Your correct answer is option A, less than 2 seconds. Next one, which nursing action should be performed first before collecting a sterile urine specimen from an indwelling urinary catheter? Your correct answer is option B, clamp the catheter for 15 to 30 minutes. Next one, the GCS scale or Glasgow Coma scale assess which three type of parameter? Your answer is option B, eye opening, verbal response or motor response. EVM, okay? Which of the following is classified as a never event in a patient safety? Your correct answer is option B, patient fall causing serious injury due to preventable error. Next is non-nursing subject like GK, maths, computer, arithmetic and reasoning, etc. Choose the correctly spelled word. Correct answer is option B, pronunciation. Next one, choose the word closest in meaning to alleviate. Your correct answer is option B, reduce. Next one, choose the correct article. He is dash honest officer. Your correct answer is option B, and he is an honest officer. Next one, choose the synonym of brief. Your correct answer is option B, short. Next one, the headquarters of UNICEF is located in. Your correct answer is option B, New York. If cat is 24, then the dog is. You have to find out the relation between cat and the number 24. So here, your correct answer is option B, 26. The rationale is ABCD का जो अल्फ़ाबेटिकल नंबर है, जो ऑर्डर है, उस हिसाब से ये आंसर हम फाइंड आउट कर सकते हैं. Like, add the alphabetical position. The alphabet D is ABCD. In ABCD, the position of D is 4th position. That's why 4. And O position is 15. And alphabetic G position is 7th. So by adding these positions, you get the answer 26. Next one, complete the series. Your correct answer is option C, 37. Rationally, the pattern is plus 3, plus 5, plus 7, plus 9. That is odd numbers. So the next is plus 11. 26 plus 11 is 37. Next one, Mohan walks 10 meter towards north, then turns right and walks 15 meter. He is now facing in which direction? Your correct answer is option C, east. Next, find the odd one out. Your correct answer is option C, potato. And all others are fruits. Potato is an vegetable. Next one, which one of the following is different from the others? Your correct answer is option D, June. Rationally, Jan, March, May have 31 days, whereas June has 30 days. So, it is the odd one out. Next one, a number increased by 18 becomes 75. Then the number is. Your correct answer is option B, 57. Rationally, let the number be x, then x plus 18, the sum is 75, then the x is equal to 75 minus 18, then we get the right answer 57. What is 30% of 250? Your correct answer is option B, 75. The rationale is 30% of 250 is 30 into 250 whole divided by 100. So the answer is 75. The ratio of 18 is to 24 in simplest form is. Your correct answer is option B, 3 is to 4. Rationally, divide both numbers by their HCF, that is 6. So by this we get the simplest ratio, that is 3 is to 4. Next one, if 8 nurses can complete a task in 6 days, how many nurse days are required to complete the task? Your correct answer is option B, 48. Next, so here the rationale is nurse days is equal to number of nurses into number of days. 8 into 6. Nurse is 8 and the days is 6. So by this we get the answer 48, which is the largest planet in our solar system. Your correct answer is option C, Jupiter. Next is the national anthem of India was written by. Your correct answer is option B, Rabindranath Tagore. Which keyboard shortcut is used to undo the last action? Your correct answer is option B, Ctrl plus Z. Next is which of the following is an operating system? Your correct answer is option B, Windows. Rationally, Windows is an operating system, whereas MS Word, Chrome, Excel are application software. CPU stands for. Correct answer is option B, Central Processing Unit. The last question is, which device is used for permanent storage of data? Your correct answer is option C, hard disk or SSD. Rationally, hard disk and SSD permanently store data even when the computer is switched off, whereas RAM is temporary memory or volatile memory. तो इसी के साथ हमारा आज का सैम्पल पेपर का एंड होता है। कमेंट में बताइए आपको ये वीडियो कैसा लगा। अगर आपको आज का वीडियो थोड़ा सा भी हेल्पफुल लगा तो चैनल को सब्सक्राइब करिए, वीडियो को लाइक करना मत भूलिए और अपना स्कोर कमेंट में ज़रूर बताइए। थैंक यू फॉर वॉचिंग द होल वीडियो। और आज का मोटिवेशन है, स्टे फोकस्ड, स्टे कंसिस्टेंट, नॉर्सेट 2026 इज़ योर्स। कंसिस्टेंट रहोगे, डेली पढ़ाई करोगे, डेली इतने MCQ सॉल्व करोगे और डेली हमारे वीडियोस को वॉच करोगे तो आपका नॉर्सेट इस बार पक्का क्लियर होगा। ओके, कंसिस्टेंसी इज़ द की टू अचीव सक्सेस इन एवरी फील्ड। ओके, तो मैं भी कंसिस्टेंट रहूँगी और आप भी कंसिस्टेंट रहिए। तो मिलते हैं नेक्स्ट वीडियो के साथ। तो तब तक के लिए हंसते रहिए, मुस्कुराते रहिए और हमारे वीडियो देखते रहिए।